Syria. Syria is a country in the Middle East and has Damascus as its capital city and Aleppo as its largest city. The official language in Syria is Arabic, but higher educated Syrian people speak English and French as well. The population in Syria is difficult to determine because of the war. In 2012, the population was 22.5 million, and in 2017 the estimated population was about 18.2 million. It has been estimated that 470,000 people have been killed in the war. The United Nations estimates that 5,000 Syrians flee the country every day, and these refugees are from Iraq, Palestine and Armenia. Of the total population, 87% is Muslim and 10% is Christian. The population in Syria have a life expectancy of about 17 years, but during war the life expectancy had dropped 15 years. The under 5 mortality in Syria is 17.5 deaths per thousand births. Work and commerce. The currency in Syria is the Syrian pound. Since the start of the war, the Syrian pound became worthless. The economy in Syria is based on agriculture and oil. The goods they export are oil, minerals, fruits and vegetables, cotton fiber, clothing, meat and animals. The main export partners are Iraq, Saudi Arabia, Kuwait, United Arab Emirates and Libya. The economic damage since the war is about 226 billion. Important beliefs. Undernutrition is one of the most important public health problems. It's responsible for the highest mortality rate in children. Several factors contribute to undernutrition among preschool children, due to poor sanitation, unhygienic environment, lack of access to safe clean water, parasite infections, poverty, illiteracy, low availability of foods and a lack of health service. Cultural values. Syrians have a social culture. They meet up together and know everything about each other. In Syria, family is very important. Every individual is loyal to their family. Women take care of the children and men take care of their family. Healthcare system. In Syria there are two sorts of healthcare systems. The first one is the public healthcare system, which is accessible for all the people. These hospitals are supported by the government. There is a government-funded healthcare and a private sector healthcare. In Syria the people don't pay monthly installments for a health insurance. Relevant topics of the target group. The war started in 2011 as a civilian uprising and the conflict has evolved into a larger, more complex war. Data showed that 11,500 Syrian children have been killed in 2013. In 2015, 5.6 million children were in need of assistance. The public health in Syria was improving before the war. The healthcare system has now collapsed. In 2013, 2 million Syrian children were estimated to be undernourished in both macro and micronutrients. In some areas there is no food available, so they can only eat what the nature offers them. All the interviewees lived in Syria. Abdu is a student and helps other refugees to translate for them. Lina is a teacher in school that helps people from Arabian countries. Abdullah is a student and he's learning the Dutch language. Ahmad has a paid job in a restaurant and did a lot of voluntary work. Ahmad works as an English teacher at the Yale University. Mohamed is also working as a volunteer to help other refugees to translate for them. Next year he wants to study IT programmer. All the interviewees think that it's a great idea to address the problem of the child malnutrition. The project does not solve all the problems, but at least we make people aware of the current situation in Syria, and that's very important. To create our end product, we collected first-hand information about the situation in Syria and about the real needs of the people living there. This information made it able for us to create an end product that will create more awareness of how the current situation in Syria really is, so that people will get more insight in the facts about the war and the effect on child malnutrition in Syria.